As Black History Month begins in the era of COVID-19, New York City doctors Nichola Davis and Julian Watkins joined Councilmember Vanessa Gibson and moderator Veronica Guiti for a discussion on COVID-19, the vaccine, and race.
This vaccine, which is here, Pfizer and Moderna, we are here to dispel any of those myths.
Despite limited supply in some states, the vaccine is still available for most eligible Americans. The CDC found African Americans were only 5.4% of vaccine recipients. Black Americans face higher COVID-19 risks but remain hesitant to trust any vaccine or the healthcare system.
A patient was concerned about writing down their race on an intake form going in to get the vaccine. And the reason why they were concerned was because, well, they weren't sure if they wrote down that they were Black, if there was going to be a different type of vaccine given to them.
In an effort to understand this degree of mistrust for the healthcare system, Councilmember Gibson detailed a moment in American history involving medical racism and experimentation on Black Americans.
We all remember back in 1932, the Tuskegee experiment that began at a time when there was no known treatment for syphilis, a contagious venereal disease. After being recruited by the promise of free medical care, 600 African-American men in Macon County, Alabama, were enrolled in this project, which aimed to study the full progression of the disease, and the rest is history.
The Tuskegee experiments were just one of several moments in history that has contributed to the mistrust of the healthcare system amongst African Americans. However, Dr. Julian Watkins says Black communities are still recovering from past and present-day trauma.
You think about the first opiate crisis that the country faced. You think about the pandemic that happened in the 80s and 90s, HIV, that crisis. People do not have confidence in these institutions because they haven't proven themselves worthy. They haven't proven themselves trustworthy or able to kind of act in a fair and just way.
Dr. Watkins and Dr. Nichola Davis have both received their vaccines and encourage everyone to consider getting vaccinated if eligible. Understanding African Americans were most affected by COVID, Davis says taking that step can avoid worsening the disparities.
It doesn't have to have that same ending because there's actually a solution that can be equitable.
To view the full panel discussion, visit @Vanessa Gibson NYC on Facebook. Reporting for BronxNet, Kibin, Alleyne.